If you have tried restricting fluids before bed, still waking up. If you have tried bladder supplements, still waking up. If you have tried prostate herbs, cutting caffeine, going to bed earlier, and you are still shuffling to the bathroom 2, 3, sometimes 4 times a night, I want you to understand something important. You have not been failing the treatment. The treatment has been failing you. Because 50 million Americans are waking up every night with this problem, and in 80% of those cases, the bladder is not the problem at all. Everything aimed at it has been aimed at the wrong organ from the very beginning. Welcome to Healthy Aging Research. My name is Emily Hart, and this channel exists to give adults over 55 the kind of honest, evidence-informed guidance that rarely makes it into a standard 12-minute doctor's appointment. Not because your doctor does not care, but because the healthcare system is simply not structured to explain the deeper mechanisms behind what your body is doing and why. That is exactly what we do here. Today we are going deep on one of the most common and most misunderstood complaints in adults over 60, waking repeatedly through the night to use the bathroom. The medical term is Nocturia, and what the research consistently shows is that in the majority of cases, the bladder is not the source of the problem. It is simply the messenger. And treating the messenger while ignoring the message is why so many people spend years managing this symptom without ever genuinely resolving it. All it takes. Now, before we move, let us talk about what is actually happening. Why Nocturia is not a bladder problem, and why that matters. Here is the first thing worth understanding clearly. A healthy body is designed to sleep through the night without needing to urinate. This is not simply a matter of bladder capacity. It is the result of a specific hormonal mechanism that functions beautifully in a healthy system, and begins to break down in ways that have nothing to do with the bladder when other systems are under stress. During sleep, the brain produces a hormone called antidiuretic hormone, sometimes called vasopressin. Think of it as a nightly message sent from the brain to the kidneys. Slow down, concentrate the urine, reduce the volume, run in economy mode. This is precisely what allows a healthy person to sleep 7 or 8 uninterrupted hours. When that signal weakens or gets overridden by other physiological processes, the kidneys keep producing urine at a daytime rate throughout the night, and the bladder fills repeatedly whether you want it to or not. This is why restricting fluids before bed, one of the most commonly recommended approaches, so often fails to help. If the kidneys are being driven to produce urine overnight by a mechanism that has nothing to do with how much you drank, going to bed thirsty simply means going to bed thirsty. The trips to the bathroom continue regardless. Understanding why the kidneys are being driven to work overnight is the entire question. And the answer, in most cases, genuinely surprises people. The 3 types. Why identifying yours changes everything. Before we get to the mechanism, there is something critically important to understand. Not all nighttime urination is the same. There are 3 distinct patterns, and the approach that helps one type can actively make another worse. Which of these 3 patterns sounds most like your nights? Listen carefully, because your answer shapes everything that follows. Before we move on, I want to ask you for a quick favor. Right now, 98% of the people watching this video are not subscribed to this channel. If you are enjoying this and finding it useful, take a second to subscribe so you never miss what we publish next. We are Type 1, Global Polyuria. This is when you are producing too much urine across the entire day, not just at night. You visit the bathroom frequently during daylight hours as well, and each time the volume is significant. If you collected everything you produced in 24 hours, the total would be 3 liters or more. The 2 most common causes are drinking excessive fluid throughout the day more than your body actually needs, or uncontrolled blood sugar, where glucose pulls water into the urine and drives unusually high output. If this pattern describes you, a conversation with your doctor about blood sugar testing is a sensible and worthwhile starting point. Type 2. Nocturnal polyuria. This is the type that affects the majority of adults over 60 who are struggling with this problem, and it is the most misunderstood of the three. The pattern is distinctive. During the day, everything is essentially normal. You visit the bathroom at ordinary intervals, nothing burns, nothing urgently demands attention. But the moment you lie down to sleep, the problem begins. Multiple trips through the night, each time producing a large volume. By morning, you genuinely cannot account for where it all came from. You barely drank anything after dinner. This is the type where the gravitational fluid mechanism we are about to discuss is almost always at the root of what is happening. Type 3. A reservoir problem. This one looks completely different from the first two. The urge arrives suddenly and urgently. You feel as though you will not make it to the bathroom in time. You rush there, and almost nothing comes out. A few drops, perhaps, and then 40 minutes later the same urgent signal fires again. This is not a problem of fluid volume. It is a problem of bladder sensitivity. The bladder is triggering at a much lower fill level than it should, either because of benign prostate enlargement in men, overactive bladder in women, or nerve sensitivity changes that come with age. Hold your pattern in mind. We are about to explain exactly why it is happening, and the answer may be one of the most surprising things you hear about your own body this year. The mechanism nobody explains: your legs, your heart, and gravity. This is the section that changes the way most people understand their body. And once you hear it, it is impossible to unhear. Here is what is happening for the majority of adults over 60 with nocturnal polyuria, the type where the days are fine but the nights are relentless. Throughout every day, you are upright. Standing, sitting, moving. Gravity is constantly pulling fluid downward. Blood, lymphatic fluid, the water between your cells, all of it pooling gently toward your lower legs and ankles. When we are younger, our veins are strong and elastic. The valves inside them hold blood firmly. The muscles of the legs, when we walk, act as a natural pump pushing fluid back upward against gravity. The system manages itself efficiently. But after 60, and especially in people who spend significant time sitting, this mechanism weakens. Vein walls lose elasticity. Valves begin to leak slightly. The muscle pump becomes less active, and fluid begins to seep quietly out of the blood vessels into the soft tissue of the lower legs. Up to 1.5 liters of water can accumulate silently in the legs over the course of a single day. You may not even notice it. Perhaps your socks leave a slight indentation when you take them off in the evening. Perhaps your ankles look marginally puffier by late afternoon than they did in the morning. These are signs of what doctors call dependent edema, and most people dismiss them entirely. Now comes the critical moment. You finish your evening, turn off the television, and lie down. The moment your body becomes horizontal, gravity no longer holds that fluid in your legs. It begins to flow back, rapidly, into the bloodstream. Within an hour of lying down, your circulating blood volume rises significantly as that stored fluid re-enters your vascular system. It is as though someone quietly injected an extra liter of fluid directly into your circulation while you were falling asleep. Your heart detects the pressure. The right side of the heart begins to stretch beyond its comfortable volume, and in response, it releases a hormone called atrial natriuretic peptide, ANP, directly into the bloodstream. Think of ANP as an emergency pressure release signal. Its message to the kidneys is immediate and direct. Filter this excess fluid out of the system now. Protect the heart from overload. The kidneys respond exactly as instructed. Within the hour, your bladder is full. You get up, empty it, come back to bed. But the fluid from your legs has not finished mobilizing. 2 hours later, the bladder is full again. The cycle repeats through the night. Not because of your bladder, not because of your prostate, not because of anything you drank. Because your legs stored fluid during the day and your heart is now working to eliminate it through your kidneys at night. That is the fire. Your bladder is simply the alarm. A story that brings this to life. Imagine Harold, age 67, retired, moderately active, not a complainer. For the past 2 years, he has been getting up 3 to 4 times a night to urinate. He went to his GP, was told it was likely his prostate, and was given a supplement to try. He restricted fluids after 6 in the evening. He tried a herbal bladder remedy he found online. Nothing made a meaningful difference. What Harold had not been told, and what his GP had not had time to explore, was that his ankles were slightly swollen by every evening, that his socks left a faint groove in his skin, that he had been spending 6 to 7 hours a day sitting since retiring, and that when he finally saw a specialist who asked the right questions, the picture became clear immediately. Harold had classic nocturnal polyuria driven by gravitational fluid redistribution, compounded by the early signs of reduced cardiac efficiency that are common and manageable in men his age. He did not need surgery. He did not need a new medication. He needed compression stockings worn during the day, a 30-minute evening walk to activate his leg muscles before bed, legs elevated for 45 minutes before lying down, and a modest reduction in the hidden sodium in his diet. Within 3 weeks, his nighttime trips reduced from 4 to 1. Within 6 weeks, he was sleeping through most nights entirely. That outcome was available to Harold 2 years before he found it, if anyone had taken the time to explain the mechanism. If you have watched this far, you already know whether this channel gives you something genuinely useful. If it does, subscribing takes 1 second and means every video we publish from this point forward will find you automatically. No searching, no missing something that matters. We are working toward 1,000 subscribers by the end of this month, and we are close. If this video earned that 1 second from you, hit subscribe now. And please hit the like button too. It helps more people over 55 find this channel and get access to the same information you just received. How to check whether this is happening to you. You do not need a laboratory or a specialist to get a clear preliminary sense of whether this mechanism is at work in your body. 2 simple assessments will tell you a great deal, and you can do the first one right now. Sit comfortably and expose your lower leg, the area between your knee and your ankle. Find your shin bone, the firm ridge running down the front of your lower leg where there is no muscle covering the bone. Place the pad of your thumb firmly against that bone about 4 to 5 inches above your ankle. Press with steady, deliberate pressure and hold it for 10 to 15 seconds. Remove your thumb and immediately run a fingertip across the same spot. If the skin springs back flat and smooth, no significant fluid accumulation. If your thumb has left a pit, a small indentation that remains visible and palpable for several seconds before filling back in, that is evidence of fluid in the tissue. Even if your legs do not look swollen to the naked eye, that pit tells you the tissue is saturated, and that fluid will move through your kidneys tonight. The second assessment is a simple urine diary. Take 1 full day and measure your output separately during the day and during the night, including your first urination of the morning as part of the nighttime total. A measuring jug from the kitchen works perfectly. If your nighttime output accounts for more than 1/3 of your total daily production, that meets the clinical threshold for nocturnal polyuria. Your kidneys are running their heaviest workload during the hours they should be resting. If both assessments point in the same direction, a pit that stays on the shin, and nighttime output above 1/3 of the daily total, the gravitational fluid mechanism is almost certainly a significant contributor to your nighttime bathroom trips. And here is why that is genuinely good news. Everything that follows is addressable. Without a prescription, without a procedure. Starting this week. What actually helps, and why these approaches work. None of what follows is a generic lifestyle suggestion. Every one of these approaches directly targets the gravitational fluid mechanism we just described. That is what makes them different from the standard advice most people have already tried without results. The single most effective intervention is elevating your legs for 30 to 45 minutes in the early evening, before bed, not immediately before lying down. The goal is to encourage the fluid that has accumulated in your legs throughout the day to redistribute back into circulation while you are still upright, and your kidneys can process it before sleep. If the fluid moves before you lie down, the overnight surge is significantly reduced. A recliner, a footstool, or simply lying on the sofa with your feet propped on a cushion, any of these work. Compression stockings worn consistently during the day physically limit how much fluid can accumulate in the leg tissues in the first place. For many people, this single intervention, worn daily, produces a noticeable reduction in nighttime trips within 2 to 3 weeks. Discuss the appropriate compression level with your doctor, particularly if you have any circulation concerns. A gentle walk in the evening, even 15 to 20 minutes, activates the leg muscle pump that helps push accumulated fluid back upward before you lie down. This does not need to be vigorous. It simply needs to be movement, taken in the hour or two before bed rather than immediately before lying down. Reducing hidden sodium in the evening meal matters more than most people realize. 80% of the sodium in a typical evening meal comes not from a salt shaker, but from processed foods, cured meats, cheese, bread, and condiments. Reducing sodium at dinner reduces the volume of fluid your body retains in the tissues during the evening hours, which means less fluid available to redistribute when you lie down. And finally, if you have been severely restricting fluids throughout the day in an attempt to reduce nighttime trips, consider discussing with your doctor whether this approach is genuinely helping your specific pattern. For nocturnal polyuria driven by fluid redistribution, daytime fluid restriction often makes no meaningful difference and can lead to dehydration, constipation, and reduced kidney function over time. The timing and source of the problem matters far more than the volume of what you drink. We are almost at the end, and I want to say something before we close that I think matters. Most people who watch a video like this one will nod along, feel genuinely informed, and then do nothing differently. Not because they do not want to, but because the gap between understanding something and acting on it is wider than most people expect. So let me make this as simple as possible. There is one thing, just one, that I would ask you to do before your next doctor's appointment. Tell your doctor what you learned today. Show them this video if it helps. Ask them specifically whether gravitational fluid redistribution could be contributing to your pattern. That single conversation could redirect 2 years of misdirected treatment toward something that actually works. That is all. One conversation. It costs nothing, and it could change everything. When to see your doctor and what to tell them. Before we close, and this is important to hear clearly, the vast majority of people watching this have a manageable, non-emergency cause for what they are experiencing. You are not facing something catastrophic, but there are specific symptoms worth knowing so that if they apply to you, you seek medical attention promptly rather than waiting. Blood in the urine without pain is the most important signal to act on immediately. Pain combined with blood in the urine is usually a kidney stone or infection. uncomfortable but not immediately dangerous. But blood in the urine without any pain, particularly dark red, brown, or clot-containing urine, is one of the early warning signs of bladder cancer and requires investigation without delay. Sudden inability to urinate despite a strong urge, where you feel desperate pressure but nothing comes out, is a urological emergency requiring same-day medical attention. Nighttime urination combined with unexplained weight loss, persistent pelvic or lower back pain, or significant fatigue that has developed recently warrants a prompt medical conversation. If none of those apply to you, take a breath. You have time to investigate calmly and methodically. But please, bring this conversation to your doctor. The self-assessments we covered today are a starting point for understanding your pattern, not a replacement for professional evaluation. A clear and honest recap. Nocturia, waking repeatedly through the night to urinate, is not a normal part of aging and is not something you simply have to accept. In the majority of cases in adults over 60, the bladder itself is functioning normally. It is responding to fluid being delivered to it overnight by a mechanism that originates elsewhere in the body. Most commonly, gravitational fluid redistribution from the legs, driven by the Hart's natural pressure management system. There are 3 distinct types of nighttime urination. Global polyuria, too much urine all day and night. Nocturnal polyuria, normal days, flooding nights. And reservoir problems, urgent signals, but tiny output. Identifying your type is the essential first step. The gravitational fluid mechanism is identifiable through 2 simple self-assessments, the thumb pit test and a 1-day urine diary. And it is addressable through leg elevation, compression stockings, evening movement, sodium reduction, and a more informed conversation with your doctor about what is actually driving the problem. The most important thing you can do after watching this video is take that conversation to your next appointment, armed with a clearer understanding of what your body is actually doing and why. Before you go, if you have watched this far, you already know whether this channel gives you something genuinely useful. If it does, subscribing takes 1 second and means every video we publish from this point forward will find you automatically. No searching, no missing something that matters. We are working toward 1,000 subscribers by the end of this month, and we are close. If this video earned that 1 second from you, hit subscribe now. And please hit the like button too. It helps more adults over 55 find this channel and access the same information you just received. One last thing. We want to hear from you in the comments today. Did the gravitational fluid mechanism surprise you? Have you noticed that sock indentation on your ankles in the evening and never connected it to your nighttime bathroom trips before today? Leave a comment below. Your experience may be exactly what someone else watching this video needs to read to finally understand what has been happening in their own body. And as always, please speak with your doctor before making changes to your routine, particularly if you have cardiovascular concerns, kidney disease, or any condition that affects fluid management. Everything covered today is educational guidance designed to support that conversation, not replace it. Take very good care of yourself. We will see you in the next one.